The following is for informational purposes only. For medical advice, please see a medical professional.
Welcome to Staying Alive with Margaret and Susy. I'm Margaret.
And I'm Susy.
Hi, Susy. So,
Hi.
Susy came up with a great idea. She said, you know what? Most of our audience is probably seniors, and it's coming up to open enrollment for Medicare. So that starts on October 15th. So why don't we talk about Medicare today? Because it's such a confusing ball of wax, and we're going to do our best to explain it. But we really wanted to take this time to explain to you about Medicare. And so I'm going to kick it off today and do my best, because I'm telling you guys, this is confusing stuff. And Susy and I both have some stories to tell you on that. And so we're going to try to kind of cover who, what, when, where, and why do you sign up for Medicare. And even that can be confusing if you're still working at 65 and have your insurance through work. You know what? You still have to sign up for Medicare. And when you first sign up for Medicare, that's called general enrollment, which is different from open enrollment, which we'll explain in a minute. But general enrollment for Medicare occurs in a 7-month window, 3 months before your 65th birthday and 3 months after. And if for some reason you miss that period, there's another exception where you can sign up between January 1st and March 31st of the following year after you've turned 65. So let's say you're close to 65 and you're in that window, and it's time for you to sign up for Medicare. You have to sign up first and be enrolled before you can make any changes during open enrollment, which is the period coming up. So let's just start with general enrollment and explain to you as best we can what the weeds are around Medicare. And so Medicare has a Part A, which is hospitalization.
Well, that's everybody gets Part A. Yeah.
Everybody gets Part A. And then you also, at pretty much the same time, if possible, sign up for Part B, and those are your outpatient services for the most part, and they cover 80% of your expenses.
There's a list of things, Margaret, that Part B covers: preventive care, diagnostic screenings, lab tests, outpatient services, and durable medical equipment. And it's also the part that is taken out of your Social Security every month. So people need to be real clear about that. You don't pay it. You don't send them a check. Right. They take it out of your Social Security.
But it does not cover co-pays or deductibles. And that's where the supplemental comes in, which we'll talk about in a couple of minutes. Now, Susy, I know that you've had some experiences with Part B where you actually found out. So for most of us, let me tell you that the cost of Part B Medicare currently for most people is $185 a month.
Right.
And that's like for a single person who makes up to like $100,000 a year, adjusted gross income. When we're retired, most of us don't go over that. Your Medicare Part B could go up to as much as about $600 a month if you're very high income, but that's not going to be for most people.
You know, when I first signed up, I think I paid $140, and now it's $185 a year, a month. Yeah.
A month.
Yeah,
and that comes that comes out of, for most of us, our Social Security checks each month. It's just taken off the top. It's a deductible on our tax returns at the end of the year. But Susy, you have a story around, you found out in your state there's a way to get some reimbursement.
Right. We have what's called a Medicare savings program, and this is something that's available nationwide. However, it varies by state. In my state, they only count your income. as part of like a DSHS program, right? So this be the same like applying for food stamps or something else. However, in my state, they do not count your assets. They do not count your savings accounts, CDs, stocks, anything like that, which makes it more likely that people might qualify based on their income. Now, they can count interest that you make on any savings or CDs, or stocks. It does make it possible to get Part B reimbursed. So what they would do is that $185 wouldn't come out of your Social Security anymore. However, it varies by state. So
where do you find out about it in your
you go
state?
through in my state it's Department of Social and Health Services, so it's a social service agency, but you can just look it up under Medicare also. I unfortunately didn't know about this program, and I would have qualified years ago. But I kind of figured they probably would count your assets, your savings and things like that, because they do if you apply for other social service programs.
Right.
In
like
my state.
Food stamps or
Right.
something. Yeah.
However, it does vary by state. And so I have no guarantees as to what each state counts as income.
Okay.
Yeah. So that can be very helpful for people.
People can look into that then.
Yes, they can.
So we're just going to go down the alphabet a little bit. I'm going to circle back. So there's something called Part C, which at this point we're not going to talk about. We're going to circle back to C. But then what's next most important is Part D, because what we haven't covered yet is that we've talked about in-hospital and outpatient. We haven't yet talked about prescription drug plan. Part D is your drug plan. And at the same time that you sign up for A and B, you're potentially signing up for Part D, which is a separate little insurance plan that we pay like $25 a month for ours. I don't know what you pay.
And sometimes it's $1. I mean, sometimes it can be very inexpensive, but not all the time. Yeah.
Yeah. So this accompanies Medicare Part A and B. And so in the Part D plan, Susy, do you want to say some things about how to check with Medicare.gov to see what drugs cost?
Yes, you can go to Medicare.gov if you know what drugs you're going to need throughout the year and find out if drugs are considered formulary or if generics are available. But it's very important to check it out if by chance you take a drug that is normally very expensive. Mm-hmm. I have friends that, put off retirement simply because their drugs were not going to be covered under Medicare. So it's very important to check with your drug plan and also to know that you got to sign up for a Part D. Because if you don't sign up, then when you do need drugs and you sign up later, the cost goes way up, and it goes up for the rest of your life.
Right. Yeah. I've known people who've made that.
So it's really important. You can say, "Oh, I don't take any drugs." Well, but you still have to sign. You still have to sign up.
The person I know who made that mistake, they weren't taking any drugs, so they didn't think they had to sign up.
Right.
And then they found out at the next year they got a letter from Medicare saying, "You didn't sign up for Part D," and like legally, you're required to do that once you're on Parts A and B. And so at that point, they signed up, and unfortunately, the cost was double what it would have been a year before.
Right.
Like it went from $15 a month to $30 or something. The other people that you can check with if you are on a prescription is your physician. And also your pharmacies. If your physician is prescribing a medication for you, you can ask them, is it the generic? Because if it is, that's likely covered. If it's not the generic, is there an alternative to that doctor and such? And if you're somebody who, say, already got something that you need, say insulin for diabetes when you turn 65, you can check and find out what your coverage is like with various plans, right?
And doctors can sometimes negotiate with pharmaceutical companies. So it's just really important to check that out when you sign up, because you don't really know too. I mean, something could happen and you need a more expensive drug.
Yes.
Yeah.
So and I remember my father got his expensive drugs through the VA. and they were
mm-hmm.
really cheap. And like there was one drug that he got it exclusively from the VA because for the vets, that drug was way cheaper.
Oh,
And
yeah, well,
some people do other things like get their drugs sent to them from other countries
well,
that no longer want anything to do with us. So like those days are
yeah, and
that's probably tariffed now, but
yeah, well, and also we have to be very clear that anything we talk about today in terms of cost can go up.
yes.
So please be careful.
Yes. So we've covered hospitalization, outpatient, and drugs, and now we're going to get into talking about supplemental insurance, which is basically plans, EFG, HIJKLM. I mean, there's so many different supplemental plans, and those plans each have different coverage, different costs because they cover different things. But in general, they cover the copays and the deductibles. The plan that I have, for instance, is one of the more expensive ones because I wanted a plan that covered coverage out of the country because my husband's from England and we now spend summers there often. I wanted to make sure I had coverage. And so there's so many different supplemental plans to choose from. And keep in mind, if you don't have the resources and you're low income, say you're a senior who has been on food stamps, well, then you know what? You are likely also a senior who qualifies for Medicaid as their supplement to their parts A and B. So you're going to sign up for your part A and you're going to sign up for your part B, and you're going to find out through your state agency if you can get reimbursed for part B the way Susy has. Hopefully you can. I bet here you could where I live. And then you're also going to go on to Medicaid for your supplement and you'll be pretty well covered.
Supplemental plans vary in cost and they also vary by region. Supplemental plans in Kansas might cost different than they do in California or Washington.
Yes.
And
the cost will vary.
We go through a broker for our Medicaid to help us make our Medicare to help us make decisions. And he has told me that prices are set by each state.
Yes.
And they're different. For instance, in where I live, Eastern Washington is a more rural area, and the costs are different there than they are in Western Washington. Unfortunately, we are at the mercy of the private insurance companies when it comes to supplements.
Yes.
And the prices go up almost every year.
Yeah.
And they can go up during the year, which I find particularly frustrating because I've chosen a plan. I'm assuming I'm going to pay a certain amount all year. Oh, no. I've gotten notices in like March or April. Well, your plan's going up.
I think that makes this a good time to talk about open enrollment. And we're going to circle back to Part C, which is something also known as Medicare Advantage. We're going to talk about that last and then talk about pros and cons. But so let's talk about open enrollment then, Susy, because once you're already enrolled, which you have to be already enrolled in A and B, then during the open enrollment season, which happens between October 15th and December 7th, that is the time when you can change things up and change your supplemental plans, change your drug plan. And this is a time of year where if you have a broker, they're going to be contacting you. Like I know a couple family members that their broker contacted them in the last month to say, you need an appointment with me right away because your area no longer covers your supplemental plan.
I know in my community that happens quite often.
Yeah. So, and I know that you changed plans during open enrollment in the past and that your broker helped you with that. Do you want to?
Right. I've changed plans almost every year because of cost. I think maybe I stayed with the same plan a couple of times, but usually we look around because coverage changes too in our community. That was the other thing. Particular doctor's office will stop taking that plan or whatever. It's very frustrating.
Yeah. And
And
you prefer to stay with your own doctor. And so if that means changing
right.
the plan, you'll do that.
Yeah, I think that's an important thing.
So we've covered A, hospitalization, B, outpatient. We've covered D, pharmaceuticals, prescriptions. We've covered supplemental, which has a whole bunch of other possible letters associated with it. And that covers your copays and other things that might not be covered on A and B. And then there's something called C. C is a supplemental part of Medicare, which is actually a situation where you've signed up for Part A and B, you don't qualify for Medicaid, your resources don't afford you the ability to pay for a supplemental insurance, and you want to choose to go with an insurance plan where you have as few costs as possible for your insurance when you're a senior. And that is the plan more commonly known as Medicare Advantage. I want to say that there is a bill that's never really gotten anywhere in the legislature to get rid of the word Medicare Advantage for Part C,
Yeah.
because what one has done when they're on the Medicare Advantage plan, which we will call it that for ease of understanding, what one has actually done is they're still paying their Medicare Part B, 185 a month, let's say, but they've signed over their Medicare program to a private insurer to manage their care for the rest of their lives.
Well, at least for that year. I mean, you can change.
Well, yeah,
Right,
yeah,
right.
yeah, yeah.
Yeah.
Thank you.
Yeah.
For the time being that they're on it. So they've signed it over to a private insurer
Who is managing their care,
who's managing their care.
And there are limits to that. You can only go where your care is managed in your community.
Right.
Which for some people would mean that if you came down with something very serious, you couldn't go to a specialist in another city.
Right.
It wouldn't be covered.
Right.
You'd still have that 80% coverage for hospitalization and outpatient things, but you would not have the 20% that Medicare doesn't cover. And the thing about these plans, they usually have a pretty high deductible, like between $8,000 is your deductible.
Now, there's one exception. I'm if you don't mind me interrupting, and that is, and I'm not going to name any names, if there is a hospital with doctors and they provide their own insurance.
Right. If that insurance has its own hospital in your community. Right. So there are some like that.
There are some like that. We have them here in California.
Yes,
so
we do too. Yeah.
Most people know what I'm talking about. I'm not going to promote it or name anything, but if you happen to be in a managed care healthcare system that offers its own senior advantage plan, is what they call it, which is their own Medicare Advantage, then that may cover everything under that hospital network. It may cover everything.
But not every community has that kind of a hospital.
Right. And not every hospital like that has the specialization for emergency services. And so,
or when you need a specialist. Yeah, that's the problem. Yeah, and I think that it's fair to say that we understand why people sign up for Medicare Advantage, and I myself signed up for it for probably the first 2 or 3 years that I was on Medicare because the cost was zero. Yeah. And I mean, I had to pay for my Part
including
B.
the copays and the deductible.
But at the time I was very healthy and, I'm fine, I don't have any health issues. Well, I think this is a good time to tell my story. And that was that I ended up being diagnosed with breast cancer in early March of 2021. And I went, oh, I have a Medicare Advantage plan. I don't have any idea where this is going. I didn't know whether it was too early in the diagnosis to know whether or not I was going to need chemotherapy, surgery, radiation. I had no idea. Fortunately, you have until March 31st to change your plan. And I called my broker and he said, you've got till March 31st. This is a supplement that will take you with a pre-existing condition. Now, there was only one in my community that would take me with a pre-existing condition. So I switched. I think it cost me $220 a month or something. And I was so thankful because guess what? I mean, I didn't really pay for anything. My bills were very low. I had radiation, I had surgery, follow-up care. It was all covered. And I'm very, very glad that I did that. Now, I think that that's an important story because you don't know. I mean, I was a pretty healthy person, to be honest. I hadn't had a mammogram in 5 years, which is like a big no-no. I was super lucky because it could have gone way worse than it did.
I'm so glad it turned out well.
So that was when we started going with a supplement, and thank goodness we did, because we've had other things come up.
Yeah,
and my husband and I. So we're very glad that we have taken care of that. Now,
well, I'll just add a little story there. So when I turned 65 and was selecting, I had known at that point I had to have knee surgery, and that's considered an elective surgery. And I am the type that wanted to choose my own. I wanted to choose who was going to operate on me. I wanted to choose what hospital I was at. So I knew that I wasn't going to be signing up for an Advantage plan. I was going to be signing up for the full ABD and supplemental, because I wanted to choose my own doctor who was going to do my knee surgery. And so I did that. And then after that, I also ended up with cancer, which was treated successfully, and a heart valve replacement that was treated successfully. All those things, like Susy said, fully covered, no copays, nothing to pay for outside my monthly premium for my supplemental insurance, and my Part B, which we have to pay for anyway. Like you still have to pay for your Part B, even if you've signed up for C or Medicare Advantage or Senior Advantage plan.
Yeah. So you really have to think about, what can come down the pipe. There's people can have accidents. I mean, if you get in a car accident, well, maybe your car insurance covers some stuff, but not all of it. And there's other kinds of accidents. So even if you consider yourself a pretty healthy person, you really need to look at your choices.
Yeah.
And see what's available, and talk to a broker and have them kind of set it up for you and say, well, these are your options and this is what you're going to be paying for and what you're not. And, there are assistance programs. There's Medicaid, there's Medicare savings programs. If you're a veteran, it's really important also to find out what kind of VA services you have in the community that you live in. And how that, if you go on Medicare, do you need to sign up for Part B, or can you just use the VA? In my community, I used to work with seniors, and some of the seniors I worked with had to go to Seattle, which is 90 miles from here. And it was not an easy thing for them to do. They don't drive. So that meant they had to get a ride or catch a special bus that left at like 7 a.m. I mean, it was not an easy thing. I hope that that's gotten better, but I don't know. And so you really need to find out what kind of services are available in the community that you live in.
Yeah. And I want to just talk a little bit about the pros and cons of sticking with your own Medicare plans versus signing it over to Senior Advantage program. And for me, the main advantages is that I want to be able to choose on my providers. And most of my friends want to be able to choose all their providers.
Right.
For
right.
instance, I had a friend whose husband needed a prostate surgery, and he said, "I'm going to Mayo Clinic." Well, hey, you can do that if you
Right.
have complete control over your
Right.
Medicare plans. Not so.
Yeah.
If you're on an Advantage plan, then it's up to the medical insurance companies and or the network associated with your Senior Advantage
Right.
plan to decide that for you.
Yeah, and you got to
And
really make up your mind as to whether or not you want that to happen and what kind of risks you're willing to take. And in my
and
community, a lot of people go, we have a very renowned cancer center, 90 miles from here. So a lot of people I know go there if they have cancer. And that's a really important option for them to have.
and they would not be able to do that if they were on an Advantage plan.
I think in a managed care plan, it really depends on the doctors and the system and whether or not they are willing to say, well, I think you should go to Seattle for your care, or whatever. You should go to San Francisco for your care or wherever, the Mayo Clinic. Not all doctors and systems will do that.
I know it's possible to fight for it. Like I don't want to end
Yes.
sounding as if we're completely against an Advantage plan for somebody who's like, I know that's going to be my only option. I do not have the extra money to pay for a supplement. I just don't.
You just have to learn how to advocate for yourself within the system that you have.
That's what I was going to say, Susie.
Yeah.
It comes back to advocacy. It loops back to where we started.
Right.
If you're in an Advantage plan, you're going to have to advocate for yourself even harder. And I've known people in Advantage plans who've actually fought the system and said, you know what? You don't have the kind of hand surgeon I need because I'm an artist and I can't take a chance that you're not going to do this advanced surgery correctly. You need to send me to this other place that has a specialist. And you know what? If you really fight the system, those systems will pay for you to go somewhere else. But that's a whole nother set of work that you'd have to go through.
And I think this is a generational thing too. I think, that's the hard part for me in that Medicare is so confusing because I'm in my 70s. But what about somebody who's in their 90s? This is very confusing. And I don't think it has to be. And I really wish that they would change some of the things and make this a little simpler for everybody. I don't know that that's coming down the pipe.
No.
And I really wish it would. Yeah.
So try to find a broker you can work with.
That's right. Try to find somebody in your community.
Go through Medicare.gov to find them if you need to.
Right. Now our broker here that we see, he has to go to training for every single plan that he covers and know exactly how the plans all work. That's his job. He's a Medicare insurance specialist. So it's not just an insurance broker who's out to make a lot of money. Yeah.
Right.
Yeah.
We're going to end it there. And until next time, we are Margaret and Susy, and we are Staying Alive.
You've been listening to Staying Alive with Margaret and Susy. This show is hosted by Margaret Cooley and Susy Hymas. To subscribe to our show, leave a comment or ask a question, please visit stayingalivewithmargaretandsusy.com. Our podcast is available on all major podcast platforms. If you've enjoyed our program, please feel free to leave us a 5-star review. Thanks for listening.